Hey everyone, it's Dr. Prabakar. I just recorded a live actually, and then something happened and it didn't save. So, anyway, I just came outside. It's better lighting. So I just wanted to share some of my thoughts about what's happening in our country this week. It's taken me a few days just to even come to terms or get some grip of what's happening. And I've had a lot of friends text me this week saying, oh my goodness, what does this mean? Even doctors, what does it mean for us as OBGYNs, as ER doctors? And so I wanted to just share some of my thoughts quickly on here. I'll start off by saying that, this is, I think, a very dark time for our country. We were just sliding backwards. And, when we think about what's happening, the first thing I just want to mention is what the repercussions of reversal of Roe versus Wade extend far, far, far beyond what we think traditionally of, what we traditionally think of when we think of abortion. Right, when someone says, oh, she had an abortion, what comes to mind is, someone who found out they were pregnant, they were not ready to have the baby, and they went ahead and, had a termination of pregnancy. So either they had a procedure or they took a pill to end the pregnancy. That's what we think about when we think about abortion. But in reality, there are many other definitions of abortion. When you look at an OBGYN textbook, there is spontaneous abortion, inevitable abortion, missed abortion, threatened abortion. And all of these other types of abortions are forms of a miscarriage that have nothing to do with the patient's choice of whether or not to end this pregnancy. Okay, so when we talk about these other types of abortion / miscarriage, these are situations where the patient could be bleeding a lot, and oftentimes they don't want the pregnancy to end, but unfortunately we as OBGYNs we have to intervene sometimes to prevent the mother from hemorrhaging and losing a lot of blood and dying. So that's the first thing I want everybody to know, is that when we talk about abortion, it extends way beyond the traditional sense of what the public thinks of as abortion. And as I'm talking to family members and other friends, most people don't know this. So I wanted to just bring that up first. And then I want to bring up 3 other points or instances where now women are not going to be able to get adequate care. The first is ectopic pregnancy. Now, an ectopic pregnancy is a pregnancy where the pregnancy is formed outside the uterus or the womb, which is where it should be in order to grow well. But in these cases, it is often in the fallopian tubes, or sometimes in the ovary, or sometimes just in the abdomen, and not in the uterus. And as this pregnancy grows, it can rupture and cause severe bleeding. In fact, a ruptured ectopic pregnancy is the #1 cause of maternal mortality, death of the mother in the first trimester in the Western world. Okay, #1 cause in the first trimester in the Western world. So I'm talking people are losing 2 to 3 liters of blood in these situations. By the way, you have about 5 liters of blood in your body. And so I've seen this firsthand. I've taken care of a lot of women with ruptured ectopic pregnancy, where they're coming to the emergency room with extremely low blood pressure, barely able to keep their eyes open, losing a lot of blood. I've taken them to the operating room, and I have removed this ectopic pregnancy and stopped the bleeding, and the patient has survived and gone home. This is one of the most common emergencies that OBGYNs face. So in a lot of the states that have now reversed Roe versus Wade and have upheld these bans, if you go in with an ectopic pregnancy and there's a heartbeat in this ectopic pregnancy, which sometimes there is, you seriously may not get treated, right? #2 is preterm premature rupture of membranes. Now that's a very fancy word for saying breaking your water early. So as OBGYNs, we've all seen this, where a patient comes in and breaks her water, at 17 weeks, 18 weeks, way before viability. By the way, if you're watching, please say hi. And if you're watching this later, please type in #replay. So in these cases, once the water is broken earlier at 22, 23 weeks, 18 weeks, the baby, often the body just sometimes gets rid of the pregnancy, and other times it doesn't, but then the mother can get seriously ill, fever, infection of the uterus, and potentially death. Luckily, we have modern antibiotics that can help with a lot of this, but one of the decisions that the mother has to make is, okay, do I need to get rid of what's in my uterus that's causing me this infection so I can then go on to live and preserve my fertility? And a lot of these times, this fetus still has a heartbeat. So, this is going to be another situation where the mother may not be able to get the adequate, care that she needs. And the third is situations where there are serious fetal anomalies. So, patients go in for their 12-week scan or their 20-week scan and find out that, there's some serious issue with my baby that is incompatible with life, or, there's no fix for this once the baby's born. And personally, I have seen, a patient whose baby didn't have a brain, didn't have a head, and she said, "Oh my goodness, like I can't do this. I'm going to carry this baby through, for the whole 9 months and potentially risk this baby dying inside me much later, or worse, give birth to this baby and then have it die right in my arms, a few hours later." And so she opted for termination. I mean, I'm talking, this was a baby without a brain, without a head, anencephaly. This is not compatible with life. And so we are greatly restricting the choice for these women who do not, who have fetuses with serious, issues, and we're greatly limiting their choice of what can be done. So I just want to remind everyone that this goes above and beyond what, we traditionally think of as, quote unquote, abortion or termination of pregnancy. This is much more nuanced. This is, this goes into, again, number one, ectopic pregnancy, number two, preterm, rupture of membranes, pre-viable rupture of membranes or breaking water. Number three, serious fetal anomalies. And I mean, there's so much more that is at stake here, but these are the three things that I wanted to bring up because this is what I've seen as an OBGYN. I can recount these cases. I can see these patients' faces in front of me, and to tell that patient, "Oh yeah, sorry, I'm not going to be able to help you or else I'm going to go to jail," is just abominable. And the fact that my colleagues are having to make this decision elsewhere in the country is heartbreaking. And so I just urge everyone to think through these issues before having conversations about this with people, not to get just, swept away by the hype of the media, but to really think about what is at stake for you, for your daughter, for your sister, for your friend. It could be your life. And this is no small matter. This is just an ugly, ugly time that, we're even talking about this. These decisions should be made between a patient and her doctor. No one else. And so, yeah, I just wanted to talk about this briefly and share my thoughts because these are the questions that people have texted me this week and asked me. And let's hold tight to see what unfolds next week. All right, I'll talk to you later, everyone. Bye.